Hello, family and friends. The month of February is Heart Health Awareness Month. Heart disease is a leading cause of death for men and women in most racial groups. Heart disease, also known as cardiovascular disease, includes coronary artery disease, heart failure, atrial fibrillation, and stroke. And they comprise the most common causes of death in the U.S., with coronary artery disease leading the pack, followed by stroke. And what is disturbing is that the prevalence of heart disease and subsequent death has unfortunately began to rise and is expected to continue to rise. According to the CDC, in 2021, about 697,000 people died from heart disease. And in 2022, 702,880 deaths from heart disease, which equates to almost 2,000 deaths per day. And to break it down even further, one person dies of heart disease every 33 to 34 seconds. From 2017 to 2020, approximately 49% of Americans had some form of heart disease, and approximately 59% of African Americans had some form of heart disease. And the average age of a first heart attack was 65.6 years for males and 72 years for females. Coronary artery disease arises when the coronary arteries, which are the primary blood vessels that supply your heart, become damaged and are subsequently unable to deliver a sufficient amount of blood, oxygen, and nutrients to your heart. It is caused by atherosclerosis, which is defined as the buildup of plaque inside your arteries. Plaque consists of cholesterol, fatty substances, waste products, calcium, and the clot-making substance called fibrin. As plaque continues to deposit on your artery walls, your arteries narrow and stiffen. This plaque will limit or stop blood flow to your heart muscle. And if your heart does not get enough blood, it cannot get the oxygen and nutrients it needs to work properly. And not getting enough blood supply to your heart muscle can lead to chest discomfort or pain, also known as angina. Ultimately, it puts you at a greater risk for a heart attack or even death. A heart attack typically occurs when a plaque within a coronary artery ruptures, triggering the formation of a blood clot that suddenly blocks the artery, thereby preventing blood flow to the heart muscle. Now, I would like to show you a visual aid showing coronary artery disease. Okay, so we see the number one artery, which is clean, and there's no plaque. However, it progressively accumulates plaque. And the last artery, number 4, has so much plaque that blood carrying oxygen and nutrients cannot get through, which is the setup for a heart attack. And this is what we want to avoid. Well, that's it for today. See you next week when we'll talk about risk factors for heart disease.